My name is Nicole Marjon, and I'm a physician scientist and assistant professor at the University of Colorado, and my specialty is gynecologic oncology. People usually know if they need to see a gynecologic oncologist because they've had a symptom that brought them to either their primary care doctor or their gynecologist. And after workup, they found something like a pelvic mass or concern for endometrial cancer, concern for ovarian cancer. The symptoms that commonly bring people in would be like abnormal bleeding or bleeding after menopause, or sometimes people come in with pain, bloating, fatigue, weight loss, things like that. And then through a workup, they find that they have concern for cancer. So they come see me. I wanted to become a doctor. I didn't decide until I was probably a junior in college. I knew when I was young, so when I was in first or second grade, that whatever I did needed to be involved in compassionate care of people. I found myself always drawn to people who were hurting or who had been bullied or whatever. I was always the first kid to run over there. So I knew that was going to be part of my career. And then in high school and college, I really was intrigued by biochemistry, human physiology, treating disease processes, and understanding why it was happening. So putting those two things together, being a physician was kind of the perfect career, being able to understand human health and disease and care for people when they really need it. And my approach to treating patients is twofold. First is for me personally staying very up to date on the most current research and the most effective care for patients with the conditions I treat. And then the second part is more patient focused. And so when I see a patient in my office, I like to really first hear about what they understand and about their values, and make sure that our treatment plan that we come up with together in a collaborative way really does both of those, treats to the best of our ability right now, and also make sure that we think about their autonomy and their values and make sure we hold those very high also in our treatment plan. What I value the most about interacting with my patients is really just being able to be there and provide them compassionate care for both them and their families. And then something I've gained from treating my patients, I think, is that they do come from different backgrounds, from different belief systems, from different cultures. And I think I've gained a lot in understanding how people celebrate life, celebrate death, and deal with difficult situations. And me personally, I've gained a lot from that, and I've been able to share that with the patients along the way. I think what I wish people knew about seeing an oncologist is that I understand that it's really scary to have the word cancer in you or your family member. And that really my goals are aligned with your goals, which is to treat the cancer the most effectively we can while maintaining a good quality of life. And that really we're here to be on your team.